Okay, so the title of our presentation is Preventing a Wildfire, and I'm Christine.
I'm Jacob.
I'm Mackenzie. And I'm Leslie.
So first I'm just going to briefly give some background on Nicaragua. And Nicaragua is the largest country in Central America geographically, and it's bordered by Honduras to the north and Costa Rica to the south. And it's divided into 17 political departments. According to the World Bank, it's a lower middle income country. 35 to 40% lack access to health services, and 48% live below the poverty line. And we're specifically going to be looking at the political department of Rivas, and that, as you can see on the map, is in the lower southwest corner of Nicaragua. Its population is 156,000 out of the total population of Nicaragua, which is about 5.1 million. It's a pretty rural area, and there are lots of plantations and beaches, and it's also prone to lots of flooding. Additionally, it's becoming more of a tourist area because of those beaches, and people are coming from like Costa Rica to go surfing there. Sexually transmitted infections are a pretty big problem in Nicaragua, and one of the reasons is because condom use is very low, and it's been reported that about 15 to 17% of people use condoms. In 2005, there was a report that said that 3,517 new cases of STIs were reported, and they primarily included gonorrhea, condyloma, and syphilis. Additionally, in another political department of Leon, between 1999 and 2004, syphilis increased like twofold, so like it basically doubled. So that means that there's a potential for this to happen for HIV. So why is preventing HIV in Rivas important? There's no cure for HIV, and it attacks the T cells in your immune system, so it depletes your immune response to different diseases. It's a strong risk factor for developing tuberculosis and many other diseases as well.
Here we provide a list of HIV rates in Latin America. We also provide two countries here at the bottom that are not in Latin America to provide context. So as you can see, South Africa has incredibly high rates of HIV. That's a situation that has gotten out of control, and it's more of a reactionary situation as opposed to preventing it. We also provide the United States here because this is a country that we're obviously all familiar with. As you can see though, Nicaragua has really low HIV rates, which is terrific. However, we wouldn't be talking to you guys right now if there wasn't something more than just that. So HIV in Nicaragua was first detected in 1987. Back in 2003, the rates were closer to 0.1. As you saw on that last slide, rates are now 0.2. And the Nicaragua Ministry of Health predicts that rates will continue to increase at more than 10% per year. The area we're specifically looking at though, Rivas has incredibly low rates. Just over 0.1% of people have HIV.
So I think it's important to consider when looking at HIV the context of Nicaragua as a whole, culturally, and one of the big cultural aspects of Nicaragua is this idea of machismo, which is multiple and early sexual encounters, that men sort of prove themselves by their fertility, and that they just exhibit everything that has to do with being a man. They're strong, they're tough, they exhibit paternalistic values, and along with this idea comes also a subordination of women, and because they're Mr. Tough Guy, it also shows that they don't really enjoy wearing condoms because of this, because it sort of hinders their virility. And so the parallel to this, which also aids in the spread, or could aid in the spread of HIV, is the Virgin Mary syndrome. And so what this is a hypersensitivity of women. So you see women as a virgin and as perfect and as pure, and you don't necessarily want to have sexual contact with her because she's so perfect and wonderful. But because of this, and because of your machismo, you still want to go out and have intercourse, so you have it with other people. And because you don't like wearing condoms, you're having sex with other people, and you're not using protection, so it further propagates the spread of disease. And so as mentioned before, with the machismo and the Virgin Mary syndrome, there's this sexual culture and sort of like set gender roles in Nicaragua that, given an increase in HIV, would spread it like wildfire. The subordination of women and the fact that these gender stereotypes sort of create this element for men to have sex with multiple women, and the fact that they're so indulgent in this sexuality means that if HIV were to ever increase in greater percentage, it would just, take off. And so I'm sure we're all thinking, why can't, with such a low rate, this just be fixed by sending some very well-educated health providers? And the problem with this is that the health promotion is sort of blindsided by this conservative, male-oriented view, and that women are the problem, so they're not actually getting together and speaking with each other about the issue. Rather, it's just saying, this is their fault, they should fix it, but even though they should fix it, I'm a man and I still don't want to wear the condom. So it's like a twisted road that needs more paving by greater understanding of the culture and how to better empower the women.
So in Rivas, there are some barriers to managing HIV for people that have it currently. One of them is that there's a definite stigma against people with HIV, and people are often blamed for having the disease because of lack of knowledge of like how it's transmitted and how people get it. Additionally, there's little support from communities and even like doctors, and like there aren't really government programs or support for people that have HIV. And there was also an example of like one doctor saying that so there were patients like drinking from like a coffee machine that had HIV, and like some of his coworkers were kind of like offended by this just because they had HIV. So even like doctors might have problems with this. And then lastly, just because of like the healthcare system, and especially Rivas, because it's a rural area, access to treatment of the ART treatment is very limited. And one reason is just location. There's only one actual hospital in Rivas, and then there's a few other like health posts, but none of these health posts have the ART treatment. So it's very hard to get to a hospital and receive that treatment as well.
So while improved care for those currently living with HIV is definitely important, and we propose just increasing access to health care, likely with improved transportation, the main focus of our case study has been on preventative measures. So as you guys saw, the rates of HIV in Nicaragua are very low right now, but the rates of STDs are pretty high. So in an effort to keep HIV rates very low, we propose hiring HIV prevention advocates at all of the health posts in Rivas. So there are 29 health posts in the district of Rivas, and hiring one advocate per health post. These advocates making an average government salary of about $40,000 a year would amount to just over $1 million in expenses. And so this is not an insignificant amount of money, but certainly in comparison to the costs that actual HIV outbreaks in the country would incur, it would be very minimal. So these professionals would have three main goals. The first would be to educate students in secondary schools. So health talks happen relatively often. Nurses from health posts go and speak in elementary and high schools to children about teeth brushing and all sorts of things. So these HIV prevention advocates would go to schools and talk about the dangers of HIV and the difference between HIV and other STDs. Talks before have been given about contraceptives and things like that, and oftentimes it's not looked at as very significant because this is a culture in which teenage pregnancy is very prevalent. So many people look at it as it not being that much of a problem. So part of the purpose of these talks would be to drive home the significance and the harshness and the reality of HIV. So HIV doesn't go away. It's not something that is very easy to live with, especially in these rural areas where access to ART is very, very limited. Ideally, these health talks would also try to focus on gender roles and explain HIV so as to destigmatize it for people that are living with it. We would also propose that these health professionals work with parents. So one way to do this would be to facilitate a parents' night for elementary school children. So generally gender roles and gender discrimination begins at a very early age. It seems really innocent. Parents have the girls stay in and help them with chores, and the boys go out and play. And it doesn't seem to be much of an issue, but that does, as we all know, lead to much larger gaps later in life. So something like a parents' education night where parents could come in and learn from this advocate about the dangers of those gender roles, and then also about HIV and the significance of that. And then the third, the health professionals would work with the tourism industry, so visiting the different resorts and large hotels and restaurants frequented by tourists. Because of the stigma, we can sort of play off of that. While we disagree with it, many employers say, oh, I wouldn't hire somebody with HIV, which isn't good, but we can play to that in some regards and say, well, don't you want to prevent your employees from getting it? And hopefully they would then be more willing to have a health professional come in and speak to their employees, as well as potentially offer free condoms for hotel guests. So as you can see, there are some beautiful resorts in Nicaragua. So those are the three main goals we would propose to try to prevent the spread of HIV.
So we recognize that our proposal has some potential shortcomings, that it's not perfect. One of these would be that funding is obviously necessary for a program like this. As Mackenzie mentioned, it would cost over $1 million per year to run something like this in Rivas. And right now there is limited funding for HIV in Nicaragua, and that would represent a significant portion of that funding, so we would likely have to find another funding source. We would probably hit up our homies, Bill and Melinda Gates, and ask them, because they are definitely involved in prevention strategies, and this is a prevention strategy in and of itself. We recognize, though, that if we were to get funding and this strategy were to be implemented, that there are potential issues, which include that children have irregular attendance at school, that because of the culture as well as other factors, that they might not attend school on a regular basis to receive the education. Additionally, parents might not be able to attend meetings, and some businesses may object to speaking with employees or providing free condoms in their business. But overall, we believe that it's a cost-effective way for us to help prevent the spread of HIV in Rivas, Nicaragua, and to keep the rates as they are, which is really low.
All right, questions?
So why are the HIV rates in Nicaragua so much lower than in the rest of Latin America?
So part of it, as we learned from our research, Nicaragua was embattled in the Civil War for years, and there were trade embargoes. It's also due to the poverty has not attracted a lot of tourism up until this point. So rates are higher in Costa Rica. I'm sure you guys have heard of going surfing in Costa Rica. That's more of a common tourist destination. So that has contributed to why they're currently low rates.
Can I ask why you chose Rivas?
So I actually visited this area over the summer, and so I was familiar with some of the issues they face, especially being a rural population and that type of thing.
So one of your goals was to try and educate like parents on the dangers of gender roles, and personally I am all for the destruction of gender roles, but do you think that you could potentially run into the problem of them not being receptive to what you're saying? Like, and then another question. So you're saying you're gonna try and get like some HIV health advocates in there. Would these be members of the community, or would they be from an outside?
So we would definitely propose training and hiring members of the community, ideally women. Women are underemployed in this area specifically. And then yes, so it would not be surprising at all, I think, to face some pushback or just general lack of interest. But one thing that I think we would look at, the educational system, especially in this area, is focused a lot on memorization. So kids just regurgitate what they're told. There's not a lot of critical thought. So we would hopefully train these health advocates to work in a way that they're inspiring critical thought amongst both parents and students. So things like, how would it make you feel if you were oppressed, and things like that. And so ideally that would have more of an impact than previous types of outreach that have focused solely on this is bad, this is why, and without much interaction.
Catholicism is quite dominant in Nicaragua. How could you take advantage of that with your plan?
So we kind of cut that in the interest of time, talking about church outreach. The evangelical community is also really strong in this area, and so to do outreach through schools as well, ideally, or through churches, sorry. We would assume that the leaders of many church organizations would not want their community members to have A, promiscuous sex, but B, STDs of any sort. So we would hope that reaching out to them and having these employed advocates with their main job being HIV prevention advocacy, being able to reach out to church communities and hopefully give educational talks to members.
Would the use of condoms be reflected in Catholicism?
So no, although that would partly be why we suggest having these health talks at schools, because the schools are governed, by the government, which is heavily Catholically based, but the health posts provide free condoms, and so the advertising of this service without necessarily, so I'm sure bringing condoms to a Catholic church would cause a lot of trouble, but subtly mentioning that there is free help at the health post maybe might be a little bit of a way to blend those types of things.
I think we've shot our 15 minutes.
Okay.
Thank you.